各位
Members, I now call to order the Council meeting. In view of the severe epidemic situation in Hong Kong, President Xi Jinping has expressed his concern about Hong Kong. He's made important directions on our fight against the epidemic. He stresses the importance of ensuring the safety and health of the public, and then we must try to control the epidemic as soon as possible. That is our first and foremost task. That shows fully that under the one country, two systems, the central authorities are giving their full support to Hong Kong. They are mobilizing all resources and taking all necessary steps to help Hong Kong emerge from the epidemic. This is to make sure that Hong Kong remains stable. I'm sure members will join me in thanking the central authorities for their support and concern about Hong Kong. The Finance Committee approved $27 billion for injection into the anti-epidemic fund. We hope the funds will be available as soon as possible to help the public tide over this difficult time. In accordance with the basic law, one of the functions of the Council is to debate the various aspects of the policy address of the Chief Executive. So that's why this meeting is held. This meeting will be divided into 4 sessions. In view of the severe epidemic situation in Hong Kong, the first debate session will be to debate the theme emerging from the epidemic. In light of the challenges we're facing with the epidemic, the SL government is doing its best to perform its anti-epidemic work. The Legislative Council is an important component of the governance structure of the SAR. So we must work together with the executive to accomplish this first and foremost task of stabilizing the epidemic. I and members of the public, I and other members will of course join the hands with the members of the public, and we will certainly prevail in this battle against the epidemic. Members, this is the first meeting that the Council meeting is conducted as a remote meeting via a video conferencing platform. I wish to remind members that while you're participating in the meeting, you must keep the video on and show your faces. Debate on motion of no legislative effect. Debate on the motion on the 2021 policy address. Ms. Starry LEE will move this motion. Members have been informed that I will first call upon Ms. Starry LEE to move the motion, and then the Council will proceed to the first debate session. Each member may only speak once in each session and is subject to a total speaking time limit of no more than 15 minutes for the 4 sessions. When a member speaks, a timer will be displayed on the Zoom screen to show the member's speaking time limit. In each debate session, I will first call upon those members who wish to speak. I wish to remind members that when you speak in a particular session, you should confine your speech to the policy areas specified for that session, so that public officers responsible for the relevant policy areas could respond to members' views in the same session. After members have spoken, if necessary, I will suspend the meeting for 10 minutes for public officers to coordinate their responses. Only public officers may speak when the Council resumes. If public officers consider the suspension of meeting not necessary, I will invite them to respond right after members have spoken. After public officers have spoken, the debate session will come to a close. The debate on this motion will last for 3 days. I will adjourn the Council after the conclusion of the motion. And I'll call upon Ms. Starry LEE to speak and move the motion. Ms. Starry LEE. President, I move the the motion as printed on the agenda be passed. As the chair of the House Committee, I'm moving this motion of thanks on the policy address delivered by the Chief Executive. I must point out that the motion of thanks motion in itself is neutral. It's moved in accordance with the requirements under the rules of procedure and the convention. Through moving this motion, there is a platform for members to debate the content of the policy address and the relevant public policies. This is for the Council to fulfill its constitutional duty. As the chair of the Health Committee, I know many members and the public are very much concerned about the government's work in fighting the epidemic. At the working meeting with the President last week, I suggested to the President to allow members to first debate the theme emerging from the epidemic in this Council meeting. I understand other members have put forward similar suggestions. I'm very much grateful to the President for accepting this suggestion, and the President has since revised the sequence of the themes and the policy areas, grouping of policy areas for the debate sessions. This will allow members to first discuss the fifth wave of epidemic and the relevant measures taken by the government in response to the epidemic. I'm grateful to the Chief Secretary for Administration for agreeing to this adjustment and making arrangement for the relevant principal officials to attend this session. I'm grateful to the Chief Secretary for Administration for attending this meeting while he is under home isolation on his own. The Chief Executive of Administration led the SAR delegation to the second mainland Hong Kong thematic meeting on the COVID-19 epidemic last Saturday, the 12th of February. On Monday, the 14th of February, he had a video conference with me and the Deputy Chairman of the House Committee. He promised that the administration will brief members on the exchange meeting. This will allow the public to learn about the latest strategies and measures to be taken by the government in fighting the epidemic. I'm very much grateful to the central authorities and presidency for their concern about Hong Kong, and he has made actually important directions on our work. He's also asked Vice Premier Han Jing to convey his greatest concerns about Hong Kong. He said that fighting the epidemic should be the first and foremost task for Hong Kong. With the support of the country, I am confident that as long as we stay united and join hands, we will definitely prevail over the epidemic. Here, I would also like to express my gratitude to all those who have made their contribution and who have put in hard work in fighting the epidemic. Here I'm talking about the frontline workers, including medical staff and other allied professionals. I'm very much grateful to you, and you're all heroes in the fight against the epidemic. I look forward to the government's concrete response to members' views on the epidemic. And after the meeting, I hope the government will also follow up with individual members. At this point, the most important is that we join hands together to fight the epidemic. Members in this council come from different sectors. They have standing at various organizations and in the community. Apart from expressing our views, I'm sure all members will be doing their very best to mobilize all resources in the community in supporting the government's fight against epidemic. President, this is the last policy address of the current Chief Executive. She's put forward her forward-looking suggestions on important policies, including increasing housing and land supply, promoting Hong Kong's integration into national development, and in enhancing governance. The Chief Executive has also introduced some 310 new measures in the policy address and the supplement. These measures covered various policy areas, including the economy and people's livelihood. I look forward to the active implementation of these various measures by the government so that we could address the livelihood issues in the community for the long-term benefit of Hong Kong. The executive-legislature relationship is always an important theme in the motion of thanks debate. This council is the first council after improving the electoral system. and it's formed by 90 members who meet the criteria of patriots governing Hong Kong. I am glad that at the first Chief Executive's question and answer session on the 12th of January, the Chief Executive mentioned that the SL government will be supporting the work of this council on all fronts. I look forward to a brand new form of executive legislature relationship between the SL government and this council, so that we could help support each other and monitor each other for good governance. Another important channel of discussion between the executive and legislature is the regular meeting with the chief secretary between myself and the deputy chairman of the House Committee after each regular House Committee meeting. At the last month, at my first meeting with the chief secretary, he mentioned that the government attaches great importance to the executive legislature relationship. He would lead all principal officials to engage in active communication with the council, and in formulating policies, they will exchange views with members as early as possible through various channels. I look forward to a close working relationship with the government officials in future. As the chairman and the deputy chairman of the House Committee, we will make use of the regular meeting as a platform regular meeting with Chief Secretary as a platform to actively promote better positive interaction between the executive and the legislature. Now, scrutinizing bill is one of the important functions of the Legislative Council. In the policy address, there are some 40 legislative proposals, including abolishing the offsetting arrangement of the mandatory provident fund and so on. Now, all these legislative proposals involve important policies. I hope the government officials will be doing proper explanation to members and stakeholders so that the legislative procedures can be taken forward without hiccups. Now, because of the Omicron variant strain, there is now serious transmission in the community of the COVID-19 virus. So the government needs to further tighten social distancing measures, and that deals another blow to the economy. And of course, it will delay the timetable to resume quarantine-free cross-boundary travel. I hope the government will take all necessary measures to fight the epidemic so Hong Kong could emerge from the epidemic, and then we could resume cross-boundary travel and restart the economy. And then together we could work together to build a better future for Hong Kong. So I move the motion.
喺 Zoom 舉起嘅手放下先。
Members, please first cancel the raise hand feature of Zoom, and then I will ask members to use the raise hand feature again. And I'll put a question to you that Ms. Starry LEE's motion be passed.
Members and staff, please cancel the raise hand function.
The
Council now proceeds to the first debate session. Will members who wish to speak in this session please click on the raise hand feature of Zoom to indicate their wish. The debate theme of this session is emerging from the epidemic. The policy area covered in this session has been set out on this page for members' easy reference. Members who wish to speak in this session, please click on the raise hand feature of Zoom. The staff will jot down your names. I first call upon the Secretary for Administration to speak, the Chief Secretary for Administration. The Chief Secretary for Administration. President, first of all, I'm grateful to Ms. Starry LEE for moving this motion of thanks, and I'm grateful to the President's special arrangement to allow me to speak before members so that I can update members on the SAR government's evaluation of the epidemic and our fight against it, and also our request for assistance from the central government. The SAR government has always stressed that we should prevent the importation of cases and the spread of the virus in the community using dynamic zero infection as the target. The strategies and measures we used in the past 2 years or so have successfully stopped the first to fourth waves of outbreak. Now we face the fifth wave of outbreak. It started in December last year. Since Omicron is much more transmissible than other strains, within a very short period of time, the number of confirmed cases rose sharply within a very short period of time. As at the 6th of February last week, the daily confirmed cases was 200, and it rose sharply to over 1,000 recently. The magnitude and pace and severity of the epidemic has greatly outgrown our capacity in a few areas. First, our testing capacity. Second, the amount of isolation facilities we have. Third, and our ability to provide treatment to confirmed cases. This has caused great pressure on our system. And recently, we've got cases of cross-boundary truck drivers with confirmed cases, and there was an impact on vegetable supply leading to price volatilities. The SL government has immediately followed up with the mainland authorities on food supply. We're grateful to the Guangdong province and Shenzhen for making flexible arrangements at once so that fresh supply to Hong Kong will not be affected. Now, because the fifth wave developed so rapidly, the SL government has mobilized all resources. Using a multi-pronged approach, we try to contain the virus, and we enhance our community testing and sewerage surveillance capacity so that we can identify cases as source, we can contain and enhance tracking, and we've also introduced restriction in testing, declaration, etc. And then we've also implemented a more severe flight suspension mechanism. At the same time, we stopped flights from 9 places with very severe outbreak to land in Hong Kong to prevent the importation of the virus. As for preventing the virus to spread in the community, we have very expeditiously tightened our social distancing measures, closed down scheduled premises, restrict dine-in arrangements to stop the transmission of the chains. These measures are the most expeditious, bold, and severe in the 2 years of fight against the pandemic. We've also expedited vaccination. Over 84% or 5.6 million of the population have received the first dose. The vaccine pass will start on the 24th of February. We believe that this will further raise the vaccination rate. As regards this high-risk group of elderly persons, the government has mobilized outreaching healthcare teams to residential care homes for the elderly, to provide examination, to enhance and expedite the rates of vaccination to protect our elders. We've also implemented a series of measures to encourage vaccination. As for our children, starting from the 15th of February, the government has further lowered the age limit for vaccination for our children to 3 years, and we are trying to promote vaccination among children on various fronts. In order to provide more room for isolation of milder cases, to prevent a major outbreak, to paralyze our local healthcare system, the SL government has converted the Penny's Bay Quarantine Center to community isolation facilities. The government has also implemented the Stay Home Safe scheme, so appropriate cases of close contacts of confirmed cases can now be quarantined at home, and we set up a 24-hour hotline starting from the 10th of this month to enhance our support to those under Leave Home Safe scheme and living household members. And then we've also implemented this new triage arrangement to focus treatment facilities on more serious cases and our elders and children confirmed cases. As for community testing, whether we are talking about restriction testing declaration RTD, compulsory testing notices CTN, or rapid antigen testing RAT, on community testing for those who would like to be tested, and also a restriction in testing of buildings and small district lockdown. All these measures involve manpower, resources. We're raising against time. The government has been very sophisticated and focused so that our limited resources can be used more effectively. Looking from the statistics, since the start of the fifth wave, we have carried out 104 RTD exercises covering 150,000 persons, and we were able to identify 525 confirmed cases, accounting for 0.34% of all those tested in these exercises. This is a much higher rate than non-targeted universal community testing exercise in the past. So given our limited testing resources, this focused way of testing is really effective. The government has done its utmost to enhance our testing capacity. We started with about 100,000 cases per day, and in February, we've already raised that capacity to 200,000 samples per day. When the Huayan laboratory in Mount Anshan Sports Stadium is established, we can further raise our testing capacity in March to 300,000 samples per day. We're now procuring RAT kits in mass quantities so as to support our testing tools. And the beauty of RAT is that members of the public can do it themselves with a high degree of accuracy. However, given the scale of the outbreak, this amount of testing capacity is still insufficient. The SL government has to enhance our ability to fight the epidemic on all fronts, and then we put a request to the central government. We're grateful to the speedy response from the central authorities, and the thematic meeting was held on last Saturday in Shenzhen. We agree that because of the high transmission of Omicron, resources and facilities in Hong Kong are facing a problem, and we have to deal with these bottlenecks as soon as possible. We have put 5 requests to the central government. First, to send mainland experts to assist Hong Kong in conducting epidemiological investigations and analysis. Second, to enhance our testing capacity. 3, to help to construct quarantine and isolation facilities. 4, to provide rapid antigen test kits. And 5, to provide beds, furniture for isolation and treatment facilities, masks, and protective gear to Hong Kong. Representatives from the Hong Kong and Macau Office, State Council, National Health Commission, Guangdong Government, and Shenzhen Municipal Government present were very willing to provide assistance in these areas. And the central government and the Guangdong province will take measures to ensure supply of fresh food, vegetables, and daily necessities to Hong Kong. And special task forces will be set up between the Hong Kong SL government and the mainland to target these problems. Under the instruction of the Chief Executive, the SL government has set up 5 task forces, namely the task force responsible for epidemiology, local experts to liaise with mainland experts to assist Hong Kong in conducting epidemiological investigation and analysis, chaired by Professor Sophia Chen. And second, the Secretary for Constitution and Mainland Affairs is responsible for the task force of enhancing the capacity of nuclear acid testing, including the coordination of community testing facilities and ancillary work in Hong Kong. Third, the Secretary for Development will be responsible for the task force of coordinating and working with the corresponding mainland authorities to construct community isolation and treatment facilities, including the identification of suitable locations in Hong Kong. Fourth, the Secretary for Commerce and Economic Development will convene the task force of ensuring medical supplies, including the coordination of delivery in an orderly manner of such epidemic supplies from the government, including beds and furniture, masks and protective gear, etc., and distribution of them to the relevant departments, organizations, and residents. 5, The Secretary for Transport and Housing will head the task force of ensuring other supplies from the mainland, including the coordination of the detailed logistic arrangements for the supply of fresh food, vegetables, and daily necessities to Hong Kong. The Chief Executive has tasked me to coordinate the relevant work, and that would include interface between the relevant bureau directors and mainland authorities, set up work targets and objectives and plan. We all understand that speed is of essence. Both parties will implement a measure as soon as it is ready, and in a phased manner, we are going to ensure that these measures are put in place. I'm sure that very soon we'll be able to see the gradual implementation of these measures. As mainland resources from the mainland arrive in Hong Kong, the government will be able to gradually expand our scope of testing so that we can really achieve the targets of early identification and isolation and effective treatment measures and intercept transmission chains to provide effective treatment to confirmed cases to safeguard lives. President, everyone in Hong Kong South government is of one mind in this all-out battle against the pandemic in pursuit of dynamic zero infection so that lives can resume to normal as soon as possible. We all need to do our part. We need universal participation. The whole community must realize that our sole enemy is the coronavirus. We must focus on our efforts to build up our strength against and our defense against the epidemic. Let's not be divisive. We should mobilize resources and whole community, and we will triumph in the end. I am all ears to members' comments, and at the end of this debate, I will respond. Thank you very much, President.
Mr. N. Menu. Thank you, President. President, members, in the face of the epidemic, we are all equal. No one could be spared. So to prevail over the epidemic, there is only one way for Hong Kong. That is, we set aside our differences and grievances, and then we work together to fight the epidemic. Some may think that it's troublesome to have to scan the Leave Home Safe app everywhere they go. But imagine there are still some in the ICU because they've been infected. Do you think it's troublesome? If you think about them, you may complain that it's difficult to get a vaccination appointment, but imagine there are those who've been infected at elderly homes and they're waiting for hospitalization. So then this is no trouble at all. So if we want to fight this epidemic, it's not just up to medical staff or government officials. It's up to all 7 million people in Hong Kong. We all need to take an extra step. But of course, it's what it's about, but it's hard to do it probably for some, because some just care about themselves. And when they see there are long queues at testing centers, and then they would actually try to speculate on the tickets. And then there are cases where there are long queues at the vaccination centers, and then some clinics are charging several $100s to administer doses. So this is a selfish behavior, and I hope that we could make improvement in terms of the system. We could ask the government to deploy more ticket dispensers and set up more vaccination testing centers and increase the quota for vaccination and so on. Well, but actually, in the fifth wave of the pandemic, we are talking about that every single day. More importantly, we need to remind every member of the public that we need to exercise self-discipline. We need to work together on this, and we must avoid gatherings as far as possible. Only then we could emerge from the epidemic and life could return to normal. Here, I would like to thank the medical staff and other workers at the testing centers and vaccination centers. I would also like to thank frontline security guards and cleaning workers who are all working very hard and perform their jobs in the face of the epidemic. I'm grateful to all the volunteers who are taking an extra step to help out. Now, every time I see you putting on the protective gear, I know that this is the Hong Kong we know. We see there are many confirmed cases who are still stuck at home because we don't have enough isolation facilities or medical staff, so that will increase the risk of infection to other household members. And in some households, they have elderly persons, they have pregnant women or young children, so they are they are anxious, and I think we could all feel for them. Of course, life is tough now for everyone because of the epidemic, but then we're not alone. There will be support coming from the central authorities, so we see hope in breaking through the bottlenecks in the healthcare system, and also neighbors help out each other so that we could help those confirmed patients or those in isolation to come out of this. Of course, there's still plenty of room for improvement, but I want to say this: we can't just rely on the government alone to fight this epidemic. Now, every time the government tightens social distancing measures, there are always some people who may suffer. Without dining service, without gatherings, people don't get work, they don't get income. But then we see thousands of cases. It's possible we could see tens of thousands of cases every day. And you may not know these infected persons, but they are all part of our 7 million community. So are you prepared to work for the overall interests of the public? So let's not complain so much. Let's be more accommodated. And accommodating, we should all take a step by taking the vaccination as soon as possible. So I speak. Mr. Yang Wing Kit. Thank you, President. Since the start of the COVID-19 epidemic, the government, healthcare workers and frontline workers have made huge effort in fighting the epidemic. I'm also grateful to the Central People's Government for their concern and support for Hong Kong. Now, when we thought we could soon resume cross-boundary travel after the fourth wave of epidemic, but then there's an onslaught of the fifth wave of epidemic, and now the testing system, testing capacity, and the healthcare system are under strain. So, of course, we know there are serious problems of delays in sending people to hospitals after they've been infected. Now, we need to have closed-loop management for isolation. Just now, the Chief Secretary already explained to us the latest arrangement. Now, this is the time for us to put fighting the epidemic first. These are extraordinary times, so extraordinary measures are called for, although it may cause inconvenience to others. Otherwise, the epidemic will spin out of control because we'll be seeing more death cases. Now, I have put forward a proposal on dynamic zero infection strategy to the Chief Executive. I put forward 10 recommendations. I'm grateful to the government for listening to my views. Now, yesterday there's an announcement that there will be 10,000 isolation units in hotels, and the Chief Executive has also announced that they will look into the possibility of using university hostels and other the Queen's facilities as isolation facilities. Now, I would also like to make suggestions on other aspects as well. First, about vaccination. Death cases from the Omicron infection are mostly elderly persons or young children. So I think the first thing we need to do to relieve the pressure on the healthcare system is to boost the vaccination rate among the elderly and young children. I know the government has been making a big effort in that, but then we see that there are long queues waiting to be vaccinated at the vaccination centers, and even in private clinics. Now, in private clinics, we see long queues, and vaccination centers are fully booked. So this is not a desirable arrangement. Now, we want to encourage the elderly and young children to be vaccinated. So perhaps we could include more medical organizations to take part in the vaccination effort. And then we could also use school halls as vaccination centers. So within a week, we could vaccinate all those who wish to be vaccinated. And then outreach teams could be sent out to elderly homes and to perform vaccination, also to have outreach groups to vaccinate street sleepers. Now, for close contacts and second close contacts, they have to be isolated. So we need rapid testing. Now we have the vaccine pass arrangement now, and the functions of the Leave Home Safe app have been enhanced, so that helps to have better tracking abilities. But still, some people, if they don't, even if they use the Leave Home Safe app, but then they don't go online with their mobile phone, then there's no way their information could be uploaded, or they could receive information about compulsory testing notices. So what I would suggest is that if the app detects that the mobile phone is not connected to the internet, or the Wi-Fi is not used, then you should ban the use of prohibited use of the Leave Home Safe app for this user. And then Octopus card could also be used as a device for those who don't have smartphones, and this will be a way for them to enter premises. The third suggestion is about testing. Now we have the support of the government and the central authorities, and there will be a new Huayan laboratory to be set up in Hong Kong that will help to boost our testing capacity. Still, I suggest that after we've boosted the testing capacity, we could increase the number of testing stations at the community level. Of course, now there are better arrangements, such as the deployment of ticket dispensers, but then there are many after the change of the compulsory testing notice criteria, there are now fewer taking the test. But if we tighten the arrangement again, and there are more people that need to be tested, then maybe we could make use of the school halls and community halls as testing points. We could also recruit volunteers in the community, because we've been doing that for some time now, and that may help to reduce the size of the queues. And with better testing, we could help to control the infection. Now, another point I'd like to talk about is about isolation facilities. We suggested using new public housing estate as isolation facilities. But as the government takes on board these suggestions, we hope that these facilities are only used for close contacts. And for residents who will be affected, I hope there will be rent assistance given to them. And then when they move in later on, they should be given a rental waiver. This is a form of compensation. And for isolation facilities, we could also make use of cruise ships, for example, because cruise ships are not put into service now, so maybe we can make use of the cruise ships docked at the Kai Tak cruise terminal, and that will provide us with several thousand rooms. Now, the government said that it will be providing more hotel isolation facilities, but we should consider recruiting more hotels for this purpose. It will help facilitate the isolation arrangement. We learn, of course, from news report there are still 10,000 people being isolating in a community. This is not desirable. In the area I serve, Pak Long Estate, Kai Ching Estate, there are many residents being isolated at home. They don't receive any help from others, so they have to go down and buy food themselves, and that would increase infection risk, of course. So that's why it's important that we move the home confinees to proper isolation facilities. Finally, on protection, to the public. Now, the Guangdong authorities are giving us, are trying to facilitate the movement of supplies, but now we only rely on trucks to ferry across our daily necessities, vegetables, and so on. But what about the train service? Because the intercity train service is not in service now, so can we turn that into cargo trains? So we could, instead of relying on truck services, we could rely on train services to transport supplies to us. Finally, I would like to thank all those involved in fighting the epidemic at the front line. They are faced with high risk, but still they are doing their best to serve the people of Hong Kong. So I would also like to thank the central authorities again, members of the public, and also the various district officers who are all working very hard at the front line too. So I hope we will all join hands and support the dynamic zero infection strategy so we could reach that target, and soon I hope there will be cross-boundary travel resumed to normal soon. Thank you. Ms. Jovi Chen. Thank you. I would like to thank the Chief Secretary. On the 12th of February, the Chief Secretary led the SL delegation to a meeting with the mainland authorities, and he very efficiently called a press stand up afterwards, and we could all see he was rather tired, and I'm grateful to him for his dedication. I'm sure the public could all feel that, even we've only seen him on the screen, and some residents asked me to convey their gratitude to the Chief Secretary. And I would also like to thank all the frontline workers for their selfless dedication in the fight against the epidemic. Now, also we have to pay our tribute to all these frontline workers who are staying put in their posts and serving the public. Now, President Xi Jinping has also made important directions in our fight against the epidemic, and he's asked the Vice Premier, Mr. Han Zheng, to convey the concern of the central authorities to the community of Hong Kong. President Xi Jinping has also made 5 points so that we could stabilize the epidemic as soon as possible. We have to mobilize all resources we have and take all necessary measures to protect the lives and health of the people of Hong Kong. Now, then there's also there's this title. There's a subject in a news report that Hong Kong's not fighting this alone. So I would like to tell the government too, when you're not fighting this alone, many people in the community would like to be involved in frontline work in the fight against the epidemic. The FTU has set up a volunteers team of over 1,000 people. We are waiting for your instructions so we could help you in fighting this new wave of epidemic. As members of this council, because we have close contact with the community, we would be happy to put forward our suggestions and comments. Now, of course, we don't want to live with COVID-19, but if you ask the public or ask the infected persons to stay at home for isolation, that means they are living with COVID, because there are people who just live in a partition room. There is no way they could be isolated from the infected person. So we need to mobilize all necessary resources and take all necessary measures. And in terms of that, I think we should consider how we could improve the isolation facilities, apart from vacant school premises or newly built, completed public housing estate. We could make use of that, and hotels can no longer do staycation because of the latest wave of epidemic, so hotels are struggling to survive. So we could also mobilize them. And apart from hotels, there are other vacant facilities on land, but of course there are also cruise ships, because cruise ships can't run anymore, so they could be used for isolation facilities. Many applying for funds as assistance under the anti-epidemic funds. But then now we are in this dire straits, so these people should also be trying to offer their help. I remember when the government first required arrivals at Hong Kong to be quarantined, and no hotels would want to offer their rooms. But then when a few hotels started to do that, other hotels joined in, because it's one way for them to supplement their revenue. At the same time, it's also a way to support the government's effort to fight the epidemic. I hope the government will take up active discussion with hotels. The FTU would be happy to serve as the bridge of communication. Now, my experience at Kwai Ching Estate is that there are residents who ask me to if they could join in the effort. So, but the housing department wouldn't allow it. So, I think we should not lie flat. We should all try to chip in. Now, the chief executive wants to be able to see her expression of feelings, and I think the public could also help us formulate strategies in our fight against the epidemic. So the government should also convey the feelings of the public.
Let bygones be bygones. I think we should formulate targeted measures to fight this fifth wave of outbreak. I hope the administration can cherish our support and care. Mr. Tommy Zhang. Mr. Tommy Zhang, your microphone is not yet unmuted. I just did. President, I speak to support the motion of thanks. I will focus on support to the various industries under the epidemic in North Metropolis, and also the implementation of one country, two system. Now, the community and the catering industry have cooperated with the government to fight the pandemic, and we agree that the measures must balance our economic needs and also fight against the pandemic. However, given the pace and magnitude of the pandemic, the government has found it hard to mobilize resources, and is worrying in terms of control of the pandemic and also our economic development. However, I'm sure that so long as the government is committed to dynamic zero infection, and with concerted efforts from the community, the epidemic will be brought under control as soon as possible. I'm grateful to the central authorities for acceding to our request for their support and care. I'm grateful to our frontline medical health care workers, testing officers, retired civil servants, and also discipline services. I am grateful to their contribution in this fight against the pandemic. I'd like to talk about the plight of the catering industry under the fifth wave. They just passed the most tragic and miserable Lunar New Year in history. Now, to stop them from serving dine-in meals, and I think it's just killing them. Well, the latest round of measure will expire on the 23rd of February, and we have stopped dine-in meals for 40 days in a row, and we've lost $20 billion. Well, in the past 2 years, we've talked about striking a balance between economic needs and fight against the pandemic. The catering industry has been very cooperative. Scheduled premises, including karaoke, bars, and nightclubs, etc., they haven't been in business in total for over 100 days. And whenever there is a minor outbreak, they will be the first to be asked. The 200,000 workers in the industry are suffering. Well, we have EPF 5.0. However, this is not really, it's just a drop in the ocean. The employers can only use a subsidy to pay rent. They cannot pay employees in the previous rounds of EAF. There was timely help for the industry. As a result, we have seen lowering of the unemployment rate, and we are among the world in terms of economic recovery. In the second round ESS employment support scheme, they spent $91.1 billion, much higher than the expected $81 billion. The industry is of the view that ESS is the best in helping the enterprises to stay afloat and to help employees. So when there is AEF 7.0, the ESS should be revived to help the industry to ride out the storm, because we don't want more restaurants to fold to further jack up unemployment rates. I hope the CS and the C can join me in appealing to all landlords in the world. Because of the dining ban after 6 p.m., there should be a rent reduction in between January and March, the traditionally best time of the year for the catering business. I hope there can be a cut of 20% in terms of rent to help the industry. Otherwise, the result will be catastrophic. Now, the catering industry is the best example in this fight against the pandemic, because both restaurants and employers have done their very best in following the infection control measures. All that can be done have been done. I think now is the time for the whole community to chip in. I'm of the view that only people with necessary medical certificate and below the eligibility age to be vaccinated, because it's time to be vaccinated to safeguard the health of the whole community. And on the North Metropolis, the last policy address of the CE has covered a large range of areas. And I think this is the most far-sighted and visionary policy address I've seen in decades. The SR government is committed to providing more land for housing supply, and there are a number of proposals from the LP included here, expediting the planning procedures, use of different site formation, and also the North Metropolis will provide us with lots of land. And this will be the blueprint for further development in Hong Kong. As early back as in 2017, the LP has already proposed this, which was accepted by the C in 2018, and that is in new housing and new town development. Infrastructure should go first, and transportation should be railway-based. However, from greenfield site to spade-ready site, nowadays it takes almost 10 years. So we must expedite the planning procedures to shorten the long approval time by different departments, and steps can be carried out simultaneously to shorten the preparation time for providing land for housing. The LP agrees that our economic focus should be shifted northwards, so we will not just focus on the southern part of Hong Kong. And the PA used a new paradigm and new future for describing the North Metropolis. Together with the 14th five-year plan, Hong Kong should be an international I&T hub, and together with the GBA development, we will have over 30,000 hectares of land in the North Metropolis. It will be an important part for Hong Kong to integrate into the overall development of Hong Kong. LP is of the view that the government has overlooked the shortage of commercial land, shopping malls in particular. We are very short of this kind of land. To develop the North Metropolis, there must be more commercial premises and not just monopolized by property developers. I hope in public housing estates we can have more shopping malls for traditional industries and SMEs and small shops, so that there can be more choices for the residents. And when there are businesses, then Kai Fongs will have job opportunities. I don't want that after the northern metropolis is developed, people have to travel elsewhere for work, and that is not real development of the northern part. LP thinks that Hong Kong should have a favorable business environment. Together with Shu Ka-fai of the LP representing the retail sector, have put this to the central authorities. This duty-free rate should be increased from $5,000 to $10,000 to follow the footsteps of 22 cities in the mainland, so that we can have more duty-free shops to promote shopping trips to Hong Kong. We have to enhance our competitiveness. Mainland residents can only take home up to $5,000 worth of commodities duty-free. And this hasn't been adjusted for a long time. The country's economy has been developing rapidly, and this allowance should be adjusted upwards, because $5,000 compared with the arrangement in Hainan, we lose out. Hong Kong to Hainan can only bring $2,000 worth of duty-free commodities. Although there is no mention of this in the policy address, the LP will continue to pursue this so that we can maintain Hong Kong's status as a shopper's paradise. The CE was able to map out the future for the northern metropolis within a few months. This is really amazing. It has got transport infrastructure, land supply and job opportunities, so that the northern metropolis will be a livable part of Hong Kong. This is a very innovative move. With the staunch support of the central government, we need to raise new challenges under one country, two system principle, and together with cities in GBA, the Shenzhen in particular, we should provide more development opportunities for Hong Kong so that we can leverage our strengths under one country, two systems. Now I'd like to turn to grasping opportunities and to safeguard one country, two systems. We are now in the post-national security law era, and we've also put in place the improved electoral system. The central government is more confident in supporting the governance of the chief executive and the work of the legislature. Chaos in the past, the difficulties in governance faced by the government are now all gone. We have now order and also tranquility in the community. LP believes that this is the best time for us to implement the plans in the policy address for the interests of Hong Kong. It's been over 2 decades since the handover. We have faced many challenges, and the central authorities have always been our staunch support. After the blackout violence, we have now revived, and we have the favorable conditions for reforms, and we can continue to give full play to our advantages under one country, two systems, and to implement the grand plans in the policy address. We're able to debate on the motion debate. I have mixed feelings. In 2019, this legislature was like hell, and because of the NSL, we can now have economic recovery, and the NPC has also implemented the improved electoral system. We have 90 legislators here from different backgrounds, and we have representatives from different sectors. In the year 2000, we had EC members. They were abolished in the 2004 term. Now they have come back. I'm pleased to see this change because we can then have more elite members of the society into this legislature. So democracy is not always about one person, one vote. Rather, we should have a Hong Kong-style democracy so that we don't have any more shows in this legislature. FC members are no longer lone wolves here, and we have more representatives from the catering industry, and we have representatives from primary, secondary, and tertiary institutions. So we can have a diversity of voices here. I hope we will not let down the central authorities for its trust and confidence in Hong Kong. Let's implement one country, two systems so that we can have long-term stability and prosperity in Hong Kong. With these remarks, I support the motion. Mr. Yeo Pak Leung.
姚柏良議員，請你開咪。
Mr. Yu, please unmute your microphone. Thank you, President. Am I coming through? Yes, please. The number of confirmed COVID cases are rising geometrically, and I think we are facing the stiffest challenge ever. We are grateful to the presidency for his care for Hong Kong, and he has instructed the Guangdong province to respond to our requests very expeditiously and provide support for us. However, to control the pandemic, we cannot just rely on the central authorities. We must share the main responsibility. And our greatest task now is to control the epidemic. We must have a wartime mentality. Given the exceptional times, we should use exceptional measures. We should unite all departments and mobilize all resources and whole community to fight the epidemic. Together with supplies from the mainland, we'll be able to put the epidemic under control in the shortest period of time.
Now, the tourism sector has never been absent in the fight against the epidemic. Hotels have been helping through the hotel quarantine scheme, and also travel sector practitioners have been helping the fight as well. We actively cooperated with the government's measures. On the 24th of January, the tourism sector has proactively cancelled all the Chinese New Year tour groups. When the local cruise to nowhere scheme was resumed in last July, we introduced the vaccine bubble concept. We hope the government can invite more from our sector to fill the gap of manpower shortage. I have several suggestions. First, the number of vaccination centers should be increased. The vaccination demand has surged drastically. We need to catch up in terms of the vaccination rates among elderly people and children, plus the booster jab. The vaccination centers are overwhelmed. The waiting time is 3 to 4 weeks. According to experts, we need to boost our vaccination capacity to 300,000 doses per day to cope with the need. The government should mobilize practitioners in the tourism sector. We have the experience in manning the vaccination centers previously. Secondly, we should use more hotel rooms for quarantine purposes. We have a huge shortage of treatments and quarantine facilities. Close contacts and household members of close contacts have nowhere to quarantine. Now, many hotels are willing to cooperate. There are numerous hotels offering their rooms for quarantine purposes. Yesterday, the chief executive mentioned that she would identify more hotel rooms for quarantine purpose. I understand that some negotiations are ongoing right now. Today, the sector will meet with the chief executive to form a plan. I hope the public will no longer have the perception that hotels are making huge profits. We should not take out hotel operators from the anti-epidemic fund. The hotel sector is doing its best to help the government in fighting the epidemic and doing its bit. Third, we have to fully utilize our tourism resources. Now, the cruise terminal has been idling for 2 years. The government can consider using the cruise terminal for quarantine and treatment purposes to alleviate the pressure of a public hospital. On quarantining and isolating suspected patients, the government is utilizing a taxi fleet to provide transport for patients. The government can also consider utilizing coach buses. I believe that the sector will be happy to negotiate with the government. President, many people are unhappy about the government's work in fighting this new wave. The government can do much better. Still, medical officers on the front line are remaining steadfast at the post. I would like to thank their effort and sacrifices. Under the epidemic, we have many people are feeling anxious. However, pointing fingers will not help us overcome the pandemic. We have to be united. We have to bring everyone together to overcome the epidemic. I urge everyone to adhere to your posts and do your best and utilize the support from the country. I believe that we can surely win and win this battle. Thank you. Professor Sun Zhong.
Thank you, President. Thank you, Chief Secretary. First, I would like to speak in support of the motion of thanks debate. Of the motion of thanks. Now, of course, we are at a critical juncture in the fight against the epidemic. For the restriction, testing, declaration, isolation facilities, and enclosures measures, I support that. And perhaps the government could also consider several points here. One, the SL government is the command center for fighting the epidemic. You need to stand united. You have to support firmly the national strategy of strategic zero infection. And you have to send out a united voice to everyone. Well, since you have decided to fight against the virus, then it's important that strong leadership. As President Xi Jinping pointed out, the SL government has to shoulder the primary responsibility in mobilizing all necessary resources, including particularly the civil servants. And if the SL government wants this council to do anything, just tell us. We will definitely give you our full support. Second point, I think what is very important is for the SL government to build a Fangqiang or makeshift hospital as soon as possible. This hospital has to be able to accommodate several tens of thousands of people, even more. I understand the SL government comes with various proposals, for example, making use of public housing estates, hotels, or even university hostels as isolation facilities. Now, for university hostels, there are tens of thousands of people living there. Many of them are non-local students. Even if you ask local students to go home, there may be some difficulties. It's not the case like Wuhan. Wuhan was able to use many of the university hostels because it was the holiday period. So the SL government could ask for emergency assistance from the Chinese authorities to build the relevant facilities, or they could even provide emergency healthcare service if necessary. You please don't forget that when Wuhan was at a critical stage, who were the first to go there to help. And it's also important, secondly, that the government builds as many Huayan laboratories as soon as possible. If we want to meet the demands, or if we want to proceed with compulsory universal testing, then we need 2 or 3 times more resources and manpower. So we then could have universal testing in an orderly manner, and then everyone who wants to be tested could be tested. And more importantly, then we could identify all the infected patients and send them into isolation treatment. If we just rely on voluntary testing or home isolation alone, we could not achieve the zero infection target. Fourth point, with the support of the central authorities, the SL government needs to make all the necessary plans to prevent any possible risks. With the support of the Guangdong provincial government, there could be stable supply of various resources and materials. And then, Chief Secretary, I'm sure that as long as everyone joins hands in this fight against the epidemic and under the leadership of the central authorities, the SL will be able to triumph. So I speak.
Ms. Eunice Yung. Thank you, President. Today, the headline in the newspaper is that the President Xi is highly concerned about our epidemic situation. He gives us our care. He suggests two measures to help us. Now, this is our top priority. We have to win the epidemic. We have to mobilize every single resource that we can mobilize to preserve the health and life of Hong Kong people and ensure stability in society. First of all, I am sure that the government has taken on board many of our suggestions, and I give my highest regards to the frontline and medical officers. It shows that everyone in Hong Kong is united. Since earlier this year, Omicron and Delta strains have entered our community, and the number of confirmed cases is at a record high. And also, we have infants and young children who passed away because of the disease. It caused a lot of heartbreak. And now we are seeing an exponential increase of number of cases, and people are scared, and we are losing faith in the government's measures. And there are voices calling for the governments to drop the dynamic zero strategy and call for coexistence with the virus. These are self-destructive thoughts. Dynamic zero is not zero tolerance for any cases. It's about early treatment and identification of cases and cut the transmission chain as soon as possible. Now, on the front of vaccination, for parents, adults can get vaccinated, and we are not too worried about serious complications. We are most worried about our children. They have been staying home most of the time, and their immunity is weakened. Now, some parents are still struggling whether they should let their children to be vaccinated. Yesterday, children as young as age 3 to 4 are allowed to get vaccinated. I have already made a booking so that my daughters can be protected. However, there are simply no places at many vaccination centers. Bookings are only available as late as March or April. Now we have to open more vaccination centers, not just for children but elderly people as well. We cannot let vaccination become our bottleneck. We have received many cases who are confirmed they have to stay home and they don't know what to do. Now, our homes in Hong Kong are small, and it is not a solution. If someone is infected, then other family members will be infected as well. This situation is very worrying. The government has to identify more sites to build treatment and isolation centers so that infected patients can enter these centers to protect their family members. Now, about Leave Home Safe. Tracing close contacts is the most crucial link in the fight against the epidemic. Now, the latest update is to pack the vaccination record with the Leave Home Safe app. Still, we don't have a central depository for tracking purpose. When we have any cases, we have to go door to door to ask for information in order to trace close contacts. This is not efficient. We have no way to quickly notify close contacts for quarantine purpose. Now, the root issue is the lack of a tracking function and the usage of big data. And also, the Leave Home Safe app requires a manual using. There are people who simply forgot or ignore to use the app. The global situation is worsening. The government should make a real name registration mandatory for Leave Home Safe app, and also add a tracing function to track the whereabouts of people and pack with the vaccine bubble. I don't understand why the government didn't do this last year. I mean, a real name registration and tracing function and tracking function. It is not undoable. There are people making a fuss about personal data privacy. Well, this is not an absolute right. The use of Leave Home Safe is for public health and protect people from COVID-19 virus. The government can make use of Section 2 of the Personal Data Privacy Ordinance to mandate a real name registration and a tracking function for Leave Home Safe, and we have a sound legal base. According to the United the United Nations Convention. Now, the right of life is the highest right. Given the seriousness of the epidemic, the right to live is should override rights for privacy. In different places, the authorities have spoken. They conclude that the concerns for personal privacy should not impede the fight against the epidemic, while preserving personal privacy. The authorities should be allowed to trace the whereabouts of people to protect the lives of people. However, it is a shame that the government decided that this function would not be added. The Commissioner for Personal Data Privacy has spoken that it would not affect the privacy of people. We have to improve this function. So I hope the government can be decisive and make it mandatory for Leave Home Safe users to make real name registration and add the tracking function. Now, in the nation, we have the prime example. The anti-epidemic system has recorded the contacts of the 1.4 billion people. Same for Macau. We have to align with the nation system. The success of the health code is flexibility. That's the principle of a dynamic zero. The color of the health code would change depending on the whereabouts and the movements of the user. It shows that it is most useful in tracking close contacts and preventing a spread of the virus. I suggest the government aligning a system with the mainland's health code. And besides, the government should do publicity work and reassure the public about the use of the app. Finally, I call for everyone in Hong Kong to fight against the epidemic with the support of the central government. We can definitely emerge from the epidemic. Thank you.
Dr. Tang Yueheng. Thank you, President. In recent days, I see that there are risks in hidden danger in some aspects of our fight against epidemics. I would like to raise them for our consideration. First point, there are 8 points. The first one, there are now some 4,000 people isolated at home. They live together with other family members. Their family members are therefore exposed to infection risk. So 4,000 people, if in each household there are 3 to 4 persons, then that means there are some 20,000 people exposed to infection risk with home isolation. Second point, for the home confinees, they have to be isolated for 14 days. But for their family members, they need only be home quarantined for 4 days, and then they could go out into the community. That this doesn't make sense. It will only add to the risk of community transmission. Third risk, colleagues of infected persons are no longer listed at close contacts. Only those living with the infected persons or those who've had meals with the infected persons are listed as close contacts. But colleagues have been in the same workplace with infected persons for some 7-8 hours. How come they're not listed as close contacts? Because that will only add to the risk of transmission in the workplace. Fourth point. Now, when people are tested positive, they may have to wait 5 or 6 days before they are taken away. And for these, confirmed cases, where they don't even have to wear an electronic wristband when they're at home, so they are free to go out. That means there is risk of transmission in the community. Fifth point, for those who do administer tests themselves, they don't get any support. Some may choose to go to the accident and emergency wards in hospitals to seek treatment, and then they have to take public transport. And when they're at the accident and emergency ward, they are there together with other patients. And triaging takes a long time too, so that again adds to the transmission risk at the hospitals. Sixth point, there are some over 40 elderly homes with infected cases, and the residents could only be isolated in situ. And then, of course, for residents and workers, they share the same facilities. So therefore, at elderly homes, again, there is transmission risk. The 7th point. Now, for restriction testing, declarations, and compulsory testing notices, there is no proper crowd control arrangement. So when people queue up for testing, there is, again, the risk of cross-infection. 8th point. The government bans cross-family gatherings, but then they allow domestic helpers of different families to gather, so that will add to the risk of transmission in the households. Now, stabilizing epidemic is the first and foremost priority. This is the primary responsibility of the ASL government. The government has to mobilize all necessary resources and capacities. They must take all necessary measures to protect the life and health of the public. Now, I mentioned the 8 risks just now. The government needs to learn from its experience in fighting the epidemic, in countering this risk, and there is a need for closed-loop management probably. So I would propose the following 8 measures. 1. The government should set up a command center for infection control, because this is the primary responsibility of the government. So, this will be this command system set up. Secondly, for civil servants and other groups who are working from home, or for others who don't get work because of the epidemic, they could all be involved in fighting the epidemic. Thirdly, with the support of the central authorities, the testing capacity must be boosted as soon as possible. Fourthly, there should be compulsory universal testing as soon as possible, or something similar to that on a large scale. Fifthly, hotels should be used as soon as possible, and other vacant buildings as isolation facilities, so that for confirmed cases, they could be isolated at the first instance. Sixthly, we should ask for help to hospitals and other medical facilities, so they could take on the more serious cases. And also, there is need to make sure that there is a provision of daily necessities to those isolated. And eighthly, there has to be more vaccination centers. We must speed up vaccination and boost the vaccination rate, especially among the elderly and young children. So I speak. Mr. Stephen Ho. Thank you, President. I'm grateful to the Council for holding this meeting in Zoom, so we could reduce the risk of infection. Now, we have to understand that under the current system, it's really hard for the government to take proactive measures against the epidemic because of living habits. So we have to change our mindset completely. We have to mobilize the entire community to join in this fight against the epidemic. So it seems that the government is moving in this direction with the latest promotional efforts, but there's still room for improvement. And then second point, I think the public have to think about this. Complaining doesn't solve any problems. So we have to consider what we could do. Say, even the agriculture and fisheries sector is not about allowing us to go out to sea, but we have to consider what we can do to meet the needs of the community. In terms of food supply, of course, we are seeing some problems. Many cross-boundary drivers are exposed to infection risk. Even if they're not exposed to infection risk, they have to be compulsorily quarantined for 3 days or even 14 days. Now, the SL government, of course, had meetings with the central authorities. We're grateful to the central authorities for responding to our requests for assistance. Still, now the central authorities have made the promise, but are we able to tie in with that? So we have to look at the cross-boundary facilities. We are watching very closely what's going on at the cross-boundary factory facilities. Now we don't see any cross-boundary drivers. Working at the same location in taking delivery of vegetable and aquatic products. But so what if there's an outbreak? Would these drivers be quarantined for 3 days or 14 days? So that means there will be no drivers to ferry across vegetable and other fresh food supply. So the government needs to think about that. When there's a short supply of drivers, and well, first of all, we have to consider how we could protect the livelihood of drivers. They need to work to earn an income. And secondly, would you consider some sort of transition arrangement? And we have that in place, so when we need to kick that in, we could. Now, this concept is right, but it's about how we execute it. In Hong Kong, in the past, we have 3 rounds of trucks delivering fresh food supply to Hong Kong. We don't need this. And then for Sheung Shui, there is another route linking to Qing Shui River. There's this train link, and it only takes 10 minutes. So if the government can discuss this with Feng Hong and see if they could do that. Maybe even with live pigs, we need truck drivers to bring live pigs to Hong Kong. But what if some of these truck drivers become infected? Then we need some backup plans. So for between Shangshui and Qingshui River, there is obsolete rail link. Maybe we could make use of that link to send pigs to Hong Kong. It's just a 10-minute journey. And I read the news reports. Someone talked about drones. Can we consider supply by drones? Now, in the past, when there were wars, the United States had to airdrop supplies, and they used some 3,000 planes to airdrop these supplies, and of course, they lost 9 pilots. With drones, of course, there won't be any loss of lives, but then would that be possible technically? Because this will help in even in a small way, because we need large quantity of fresh food supply every day. Third, another point, we also need to rely on ourselves. Apart from fresh food supply from the mainland, can we produce more food supply in Hong Kong? Now, there are 72 farms in Hong Kong. 39 are chicken farms. Chicken farms supply 100% of the live chickens in Hong Kong. Otherwise, where do chickens come from? Of course, they come from eggs, as one would say, but some of these are fertilized eggs, and then we also have fertilized eggs. And at the same time, we need chicks, supply of chicks from the mainland. Now, when Mr. John Lee led the delegation to Shenzhen, well, they have ensured the Green Channel, but then they have not included chicks as in the list of supplies. I understand that you have also taken over the collection point. So for 6 days, we have no supply of chicks from the mainland. Usually, it takes about 60 days for chickens to be raised. And so if we still have no supply of chicks, then soon Hong Kong will run out of live chickens. I hope the SL government could consider how we could ensure the supply of materials that could ensure local production. And now I won't speak for everyone in Hong Kong, but then there are some who have asked for the relaxation of the requirement of for slaughterhouses, so that we have to clear all the pig supply and chicken supply every day. But that's for prevention of swine flu and so on. We have to we had to cull some 4,000 pigs before, so we need to be very careful with our biosecurity measures, and we have to stay firm to these measures. We don't have to. We can't just look at today or tomorrow. We have to look at 2 months from now, for example, or 1 year from now. Would we be increasing the risk of swine flu, and then that will only lead to reduction in the supply of pigs? Finally, for fishermen, we hope to avoid using the AEF as far as possible. We hope to be able to rely on ourselves. But then for fishing vessels, they're caught in the policies of the two places. Of course, you're giving us $10,000, $20,000, but that's still a far cry from our operating, meeting our operating costs. I have to pay the government, repay the government in loans by some $200,000, $300,000 anyway. We thank you for delaying the repayment schedule, but you need to relax the various requirements, and you need to coordinate with the banking authorities so people could still produce the goods with relaxed requirement. They say that some say that we have many volunteers coming over, but we need to make sure that we have to agree that these volunteers have not received any training. Now, apart from compared to the civil service working from home, these volunteers don't have the necessary skills. The government should rather mobilize people properly. So for goods that require skills, that should be for jobs that require skills, that should be left to civil servants. Some civil servants are not willing to help in the fight against the epidemic. But if someone needs to do the work, then the government has to or wants to delegate it to other groups. Well, but really it doesn't make sense. And I believe we should not leave civil servants out and bring volunteers in. And volunteers should not be involved in frontline work because the public still have much grievances. And if people have negative views of something, they will say, well, how come the government is only using volunteers? But what about the chef actually preparing food in the kitchen? They have to show some responsibility too. So I would suggest that the government should ask civil servants to can help volunteers to help with other tasks after some training, for example, bottling, disinfectant, and so on.
Lastly, on Leave Home Safe, actually, at the start of the epidemic, we already talked about the health code, and when the Leave Home Safe app was launched, many legislators said that it was useless because it was downloaded on a voluntary basis and there was no tracking function. But then the administration has been asking people to scan the app when going into restaurants and at different places, and it can also be used for the vaccine pass in future. So reluctantly, we accept this arrangement. However, this Leave Home Safe app has no tracking function. A few months down the road, will it still suit the needs of our fight against the epidemic? I think the administration must change its mindset in order to have a brighter future. I pause here and I will speak in other sessions. Mr. Horace Zhang. Thank you, President. First of all, I want to thank everyone every official and every frontline worker, and including frontline cleaners, who is working very hard on a daily basis in this fight against the pandemic. Now, we should not complain. We should not point fingers at this point. As said by many members, we must stand united to fight the epidemic. With the support of the central government, I am confident that we can prevail over this wave of outbreak. The DAB at this critical juncture will ensure that we cooperate with the government and the community. All our DAB members at the forefront at restriction and testing areas have been organizing voluntary teams. So whether we talk about face masks and RAT kits, given the shortage, we will do our every bit to help the community to ride out this storm together. To face the challenges, the administration should not just see what it has done. It should also review the shortcomings in its policy and implementation and what's lacking in the community before we can do a good job. And I think coordination is the most important part. Earlier on, we talk about the restriction and testing exercise in Kwai Chung Estate. There was some delay leading to spread of the virus. And then there were occasions when buildings were restricted and subject to restriction and testing, but then residents were told that no dinners could be served, and this is not very desirable. We must expedite our work in the following areas. For instance, preliminary positive cases are required to take public transport or taxis from home to hospitals and back. I think this will aggravate the epidemic, and yet as of today the administration is not able to provide transport. And as mentioned by some of the members, we are short of isolation facilities, so confirmed cases have to wait for admission to hospital at home, and that can heighten the risk of infection among family members and people in the same building. And vaccination capacity is insufficient. It's hard to book a slot. So these are bottlenecks. I hope the administration can determine to review these aspects. First, on vaccination. Of course, when the epidemic has stabilized, many people were unwilling to receive the jabs, and that's a fact. But now, because of the wave of outbreak, many people would like to be vaccinated as soon as possible. I hope the administration can boost its vaccination capacity the soonest possible so that people can book slots as soon as possible. I've been discussing with doctors in the private sector. Although many private practitioners would like to take part in the vaccination exercise, the Department of Health told them they will not be allowed to join now. That being the case, it's impossible to raise the vaccination rate so quickly. I think it's a bit silly if we do not vaccinate people as soon as possible. And in recent days, parents are trying to book a vaccination slot for their children. However, the system was planned for adults. When you ask for the first jab, the system will automatically give you another appointment 1 month afterwards for the second jab. However, many experts have advised that there should be a gap of 12 weeks between the first and second jabs. But the computer system is such that it can only be 4 weeks or 8 weeks. And parents have no choice but to book a date 4 weeks afterwards for the second jab. And so they have taken up the slot and just to reschedule the vaccination date later. So this is wasting our resources. I don't know whether the government is aware of this. I hope the system can be updated as soon as possible. As for isolation facilities, at long last, we heard from the government yesterday that public housing estates would be used for isolation. This is really too slow because the shortage of isolation facilities did not just happen last night. And government have plans to use we asked the administration to use student hostels of universities for isolation, and the answer we got was this is to be further discussed. How much time do we have? Time do not wait for men. We must expedite. We must work harder. And now, for those who are subject to the Stay Home Safe scheme, they can still move around freely. They haven't been given sufficient advice. And those who are confirmed and waiting to be hospitalized at home is not given food, medication, and support because of the overcrowded living conditions in Hong Kong. Sooner or later, household members will be infected. There is a hotline set up, and we understand that the confirmed cases are looking after themselves at home. They can only ask their friends and relatives to supply them with daily necessities. I don't think this is of any good to contain the current outbreak. I hope we can all be engaged and work together to fight the pandemic. Thank you. Mr. Andrew Lam. President, I'd like to take this opportunity to thank all who have been dedicated in their positions to fight the epidemic. Of course, there is room for improvement in our over 2-year fight against the pandemic. But then this is already the 5th wave of outbreak of Omicron, and I think we should commend our workers for their dedication. We have seen record highs in the number of confirmed cases every day in this wave. And that is exactly why all Hong Kong people should unite. We should be vaccinated, wear our face mask, observe hand hygiene, and stay home so that our economy and also people can move out of the current situation ASAP. A few days ago, there were problems with supply of fresh food. The administration must show the public its determination and confidence. I suggest that a command center should be set up under an emergency response center to deal with issues reflected by the public immediately. We have seen tremendous challenges. For instance, with a great demand for nucleic acid tests, and people have to stand in queues in a cold winter waiting to be tested, and people are waiting to be admitted to hospitals for treatment. The development of the epidemic has outgrown the capability of the administration to respond. I think this is the best time for us to show the advantage of one country, two systems. President Xi has been very forthcoming, and suppressing the epidemic is the paramount task here. This request from the administration has been speedily responded to by the central authorities. Last Saturday, there were mainland experts to help the SL government with the full support and coordination from the mainland. I'm sure we can help our people. And as for hardware, the administration must show its ambition to construct and commission new isolation and treatment facilities ASAP. Available resources should be used. In addition to unoccupied PRH estates and also hotels, the administration should mobilize private hospitals to admit the milder cases or those who cannot be quarantined at home. And private hospitals should share and treat patients that are non-COVID patients. And we do not have any worry about supplies of food, but the government must ensure good logistical arrangement to ensure that our needs can be met. Many people are waiting at home to fight the pandemic. They under the Stay Home Safe scheme, the government should take care of their physical as well as mental needs. Social workers and psychologists should inquire about them online or by phone to understand their latest condition. There are many civic-minded persons in the community. They are willing to do their part in work such as delivering meals and to visit elderly persons. The Chinese medicine sector and also the Western medicine sector have expressed their wish to help. The government has organized volunteer teams to send out anti-epidemic kits, including face masks, to members of the public. I think they should be given dual training and supportive gear so that they can serve the community and build positive energy. Hong Kong has freedom of expression, and that's why the government should be accurate and swift and focused in disseminating information to the public. Because if people with ulterior motive abuse the situation, that is not desirable. The government should take a preemptive approach. We must achieve dynamic zero infection. We should identify the sources and track them down and then intercept the transmission chains. We do not have any tracking function. I urge the administration to use information technology on public transport and also at different premises. We must track down these people so that we can move out of the current plight and we don't have to worry about the development of the epidemic.
Yesterday, with amazing speed, the government has put together the Anti-Epidemic Fund 6.0 and submitted it and tabled it for the FC's approval. And it received unanimous support from the members. It shows that we can do anything if we are united. With the support of the central government, we can definitely do a better job and overcome and rise above the epidemic. I so submit. Mr. Lam Chen Sing. Thank you, President. Well, we didn't expect that the debate on the motion of thanks would coincide with the time where the epidemic is at its height. We don't have any luxury to blame others or slack. We have to be concise and swift in tackling the epidemic. We have to protect the life and health of people. In fact, the dynamic zero strategy is the strategy that the government has adopted for 2 years. Learning from the successful experience in the mainland, Hong Kong has minimized the number of fatalities. It shows that the strategy is working. I am so grateful for the central government for accepting the request made by the Hong Kong government, including helping Hong Kong to boost its testing capacity, sending mainland experts to Hong Kong for tracing, for supporting and tracing and investigative work. These will surely help us achieve success. I am grateful to the frontline medical staff. They have been working tirelessly for 2 years. 2 days ago, I saw on the news that an ambulance had a traffic accident, and according to the fire services department, the transport of patients was met with difficulties. We are very concerned about the prolonged working hours for frontline staff as well as the stress. I hope that the government and the HA would do its best to ensure that there is the best equipment for them. We and our union have offered anti-epidemic kits for our members. Many members told us that we should provide the help to those in need. This is the spirit that we need. A year ago, we had 3 consecutive months of dinner dining ban. Still, our economy recovered admirably in the second half of the year. It shows that if we seize the next 1 or 2 months' time and boost our vaccination rate, boost our protective barriers, and ramp up our testing and isolation facility, and engage community lockdown if needed, then we may still see a resurgence in the second half of the year. I so submit. Reverend Canon Peter Douglas Kuhn. Reverend Canon Peter Kuhn. Am I coming through? Thank you. President, the Chief Executive has delivered the 2021 policy address. She mentioned that despite all the grand plan, the top priority is to contain the epidemic with our best efforts. It shows that the administration attaches the greatest importance to the anti-pandemic efforts. In view of the quick surge of the latest wave, the daily new case numbers has breached 1,000. The worsening epidemic is bringing our healthcare system to its brink. Thousands of confirmed patients as they are waiting at home. The system is overwhelmed. From quarantining to lockdown, it caused a lot of anxiety and dissatisfaction. The problem is more than the lack of testing capacity. It's about ensuring enough beds and quarantine facilities to deal with the sheer number of confirmed patients. In the past few days, the government offered measures to identify more space. Still, we have the manpower problem. Manpower situation is breaking as it seems for our hospitals and the HA. I would like to thank the frontline medical staff and the relevant staff for their best efforts. President Xi has spoken on how to control Hong Kong's epidemic. He requested the central authority and provincial governments, as well as the Hong Kong SAR governments, to fight against the epidemic with its best efforts. I urge the Hong Kong SAR government to make a request to the central government. Patients in Hong Kong can choose to receive treatments in the mainland. I believe that given the current developments, we cannot deal with the situation. According to the preliminary estimation, we are having more than 10,000 confirmed patients just in a few days. While with the help of the mainland, people can receive immediate treatments in the mainland. Well, some may say that it is against the one country, two systems principle. However, Hong Kong is an inalienable part of the country. When we are facing difficulties, I believe that our motherland will be happy to help. With the staunch support from the central government and with the united efforts of our society, I believe that we can rise above the epidemic and return to normal and see a rebound of the economy. I support Ms. Starry Lee's motion of thanks. Mr. Chu Kwok-keung. President, the epidemic has taken a turn for the worse. According to schools, teachers, many teachers, parents, and students have caught the virus. There are even staff at dormitories who were infected as well. Well, the regional officers would ask the schools to contact the CHP. However, the hotline will not come. They cannot come through for 2 days, and the schools are left helpless. I hope that the government can work with the CHP to update the guidelines for schools to deal with the emergencies, so that the schools would have a clue of what to do. And also, schools should be allowed under emergencies. They can choose to close their schools on their own to prevent the spread of the disease. And also, the EDB should gather the number of students at home during the suspension of schools so as to prevent gathering of people on the streets. Schools are facing a lot of challenges. There are a lot of teachers and there are a lot of students, especially at special schools. Students are not adept at self-care, so there should be more support for them. If the guardian is the hostel manager, then these students should not be given classes during the school suspension period. And also the subsidy for year 2022 and 23 have been spent. Schools have to procure testing kits and anti-epidemic resources, and so the government should help schools in terms of helping them to carry out a disinfection. Now the government has lowered the eligible age for children to get vaccinated to 2 to 3, and however, schools with fewer students cannot opt for outreach vaccination. So maybe the government can consider lowering the threshold and allow a joint application for vaccination. Many parents are anxious about getting their children vaccinated. The government should do better publicity work and alleviate parents' concerns with scientific data so as to boost the vaccination rate. Many schools are worried about the vaccine pass, which will be implemented next week. Schools worry that it would cause gathering of crowds and it may be chaotic. So I hope the government can issue the directions as soon as possible. Thank you. I shall submit. Mr. Kenneth Leung. Thank you, President. I speak in support of Ms. Starry Lee's motion of thanks. First of all, I thank the central government's support for the Hong Kong SAR. All resources will be mobilized to help the HKSAR government to contain the disease and protect the life and health of Hong Kong people. I also thank all the medical staff as well as staff at the testing stations, vaccination centers, and frontline hospital authority staff. They risk themselves to protect Hong Kong. Recently, many civic-minded people in the community are volunteering to help. During the Chinese New Year, they stepped forward to maintain order and distributed testing kits. They really command our respect. In the past, we see that there's an anti-epidemic fatigue. Sometimes the measures cannot catch up with the developments of the epidemic. The government has taken on board members' suggestions to improve. Now, after the thematic meeting with the Guangdong government, it is expected that our testing capacity as well as the supply of resources will be improved. We thank the central government for its swift response. President, now we are at a critical moment. This is not a time to review or point fingers. We have to give our full-hearted support to the work and achieve dynamic zero and return life to normal. Every Hong Konger should contribute the efforts. In the near future, I will start a youth platform with our young friends to fight against the epidemic. We will organize volunteer teams to help the government. And also we would help to distribute testing kits, face masks, and so on to needy people, like other members have said. Therefore, we are concerned about confirmed patients at home. We are worried about their mental and physical health. We will set up a hotline concerning inquiries, and also we will set up a specific hotline for needy families with special needs. We cannot just rely on the government and the central government. Every Hong Konger must help. The government should also bring in help from the community so that we can support each other amid the epidemic. I hope the government can take the initiative to liaise with NGOs and community organizations, bring together people from different sectors and provide training for them. Now let's fight this epidemic together and overcome this wave. Thank you. I shall submit.
You.
Mr. Tony Jay. Thank you, President. President, with the worsening situation of the fifth wave, we are seeing 1,000 cases per day. The government has tightened social distancing measures. Some people are doubting the zero infection strategy. They think maybe we should adopt the coexist with the virus strategy like the Western countries. Well, it is essentially surrendering to the virus. Well, those countries, unlike our country, lack the ability to achieve dynamic zero, nor do they have the resolution. Well, abandoning the zero infection strategy can alleviate the restrictions. However, it will cause a drastic loss of life. Life is what matters most. We don't want to see even one death. Well, if we adopt the coexist with virus strategy, maybe we can resume traveling with other countries. However, we will never be able to resume cross-boundary travel with the nation. The mainland may tighten restriction on delivery of goods, and then we will see a surge of price, a surge of fresh produce price, as well as construction materials and other supplies. We will lose in the end.
So Hong Kong must mobilize the whole community to fight this epidemic, and then we could achieve zero infection again. Here, I would like to say this to all government departments at all levels, and also for all who are involved in the fight against the epidemic. I pay my tribute to you. Let's all work together. I'm sure we shall prevail over the epidemic. Mr. Chen Siu-hong. President. Well, I'm glad to see that you have revised the agenda so that we could first debate this very pressing issue. Before I speak on emerging from the epidemic, I would like to express my support for Ms. Starry LEE's motion of thanks. For the 2021 policy address delivered by the Chief Executive, it is pragmatic and forward-looking. The 2021 policy address is no longer just focusing on Hong Kong. It also looks at the national development and in particular development of the Greater Bay Area, because these are important opportunities for our future development too. But then we must realize that we have to first keep the epidemic under control. That's the basis for all developments. So if we cannot control the epidemic, doesn't matter if we have a rosy picture of the future of Hong Kong, it will amount to nothing. The epidemic is really severe at the moment. It's worrying. In the past 2 years, the government has done much in fighting the epidemic. In the previous waves of outbreak, with the effort of the government and the support of various sectors, we've managed to control the epidemic, and the conditions were created for resuming cross-boundary travel. And then there were also people-based policies. But then at the beginning of the fifth wave of outbreak, because there's no strong awareness of risk control, so we have no decisive steps were taken to control the infection, so we've missed out on the golden opportunity to keep the epidemic under control. Now, we have exceeded the capacities of the SL in fighting this epidemic, such as in terms of testing capacity, isolation facilities, and even ensuring steady supply of daily necessities. I'm glad to hear from the Chief Secretary that there have been new arrangements with the mainland. So we see hope. In particular, the various central government departments and experts, and also there's the Guangdong provincial government, Shenzhen municipal government, and Hong Kong as a government forming a mechanism for coordination. So we have experts help on various fronts in testing, building of isolation facilities, ensuring the steady supply of daily necessities, and so on. Now, if we want to control the epidemic, both the government and the general public have to have a strong, heightened sense of awareness of risks. We need to block all loopholes where there could be risks from imported cases or local infection, and then we could achieve the dynamic zero infection strategy. With the help of the main authorities, we should build Huayan laboratories as soon as possible to boost our testing capacity. Otherwise, there's a backlog of testing, and that may lead to cross-infection. And then on isolation and treatment facilities, the government is going to make use of a newly completed public housing estate, and also perhaps the government could consider using vacant school premises, and also make use of hotels and other places to use as facilities, because we don't want infected cases to stay in the community and increase the risk of infection. The government should also build more ice treatment facilities, including the building of makeshift hospitals or Fangchang Hospital. Now, public must not think that we don't have enough capacity ourselves. As long as we all enhance our risk awareness and pay attention to our personal hygiene, as well as avoiding going out as far as possible, then we could also make use of the tracking system of the government, and then that's the best way we could contribute to this fight against the epidemic. President, I would like to take this opportunity to thank the central authorities for their support. Every time when Hong Kong faces problems, the country always gives us a helping hand selflessly. We're grateful to medical staff, testing staff, property management staff, cleansing workers, and all frontline workers, as well as the discipline forces for staying or for performing their duties. They are all heroes in my eyes in the fight against the epidemic. President Xi Jinping has asked Vice Premier Han Jing to convey his greatest concerns about Hong Kong. I thank President Xi for his reminder. That is, the SL government should take up the main responsibility in the fight against the epidemic, and this is our very top priority. And then to stabilize and control the epidemic, and then the authorities should mobilize all forces and resources and take all necessary measures and protect Hong Kong people's lives and health, as well as ensure Hong Kong's social stability. Now, we know that both the government and the public have every duty to fight against the epidemic. Everyone needs to be involved. That is the key to success. With the support of the central authorities, I hope very much the epidemic will be brought under control soon, and then we could implement the various ambitious measures in the policy address. So let's all work together to prevail over this epidemic. Thank you. Dr. Lo Wai Kwok. President, I'm grateful to Ms. Starry LEE for moving the motion of thanks on the 2021 policy address as the chair of the House Committee. Now, in view of the severe epidemic, the president has decided to have the emerging from epidemic theme to be the first to be debated. Now, the government should address all the pressing concerns of the public. President Xi Jinping has made important instructions on our fight against epidemic. He said the SL government must earnestly take the main responsibility and mobilize all necessary resources, take all necessary steps to protect people's health and life and ensure our social stability. This is to make sure that as I said, is to make sure we have a stability. And then, as President Xi Jinping has also asked the central local authorities to fully support and assist the SL government in its anti-epidemic work. The President Xi Jinping has also expressed concerns about the situation. The government has announced a fund injection of $27 billion into the anti-epidemic fund to launch the sixth round of anti-epidemic fund measures. So this will give assistance and subsidy to those who are affected. And for the first time, $10,000 of cash assistance given to be given to the jobless. Yesterday, there was a special meeting of the Finance Committee via Zoom, and the proposal was approved because we can't wait a minute to launch these measures. The Chief Secretary for Administration also led the SAR delegation to the thematic meeting between Hong Kong and the mainland on COVID-19 last Saturday. The five task forces are set up to implement various measures to give full support to Hong Kong in fighting the fifth wave of epidemic. BPA welcomes this, and we are grateful to the central authorities for their support and concern. Now, with the full support of the Guangdong provincial government and the Shenzhen municipal government, I'm sure Hong Kong will prevail over this epidemic as we all stand united. Now, we've seen several waves of outbreak in terms of testing capacity, isolation, facilities and treatment facilities. We could more or less cope in previous waves, but now we are seeing the fifth wave of outbreak involving the highly transmissible Omicron variant strain, so we don't have enough capacities in these three areas. The people look forward to support from the central authorities. I hope the five task forces will come up with some measures addressing our shortcomings, and I hope the government will implement these measures as soon as possible and make an announcement to the public. And that will help to boost confidence in the community in the fight against the epidemic. For healthcare staff, civil servants, disciplined forces, other frontline workers and volunteers, I'm grateful to them for their hard work. Mr. John Lee gave an account of the progress of the meeting on the 12th of February. I could see that's a positive response from all the different sectors. Now, more importantly, the government must keep tab of the actual situation on the ground and also realize the difficulties that people have. For example, we don't have enough testing capacity, so people have to wait for a long time in the cold to test, and then there's the risk of cross-infection. Now, there's easy way out is to give out tickets, and then for vaccination for the elderly, there has to be better arrangement with a larger coverage. In fact, in mid-November last year, the experts committee has suggested lowering the eligibility age for the Sinovac vaccine to the age of 3, but it's only recently the government announced lowering the age to 5 years and recently to 3 years. The long delay is, is something we can't understand. And then the government now says that it will be procuring more rapid test kits. And the chief executive yesterday announced that 200 million rapid test kits will be procured, but we don't know when and how you're going to distribute these packs. So people are really anxious. The government has to announce the details soon to put people's mind at ease. The PPA appeals to the public to join us in the fight against the epidemic. As we stand united, we'll be able to tide over this difficult time. I hope the financial secretary, in delivering his budget next Wednesday, would offer various relief measures. Where we need to spend, the government should not be a scourge. And also we need to do all we can to stabilize the epidemic and resume cross-boundary travel soon, and then we could proceed with our various construction plans and address people's livelihood issues. We hope that our economy could recover as soon as possible, and that will bring about improvement to the public. In the in October last year, the chief executive delivered her last policy address for this term of government. She's taken on board various views of the public. She's actually taken on board some 80 recommendations of the BPA. That includes the development of the New Territories North, and also we have put forward proposals to increase housing and land supply, developing Hong Kong into a cultural exchange point. And I believe the BP believes this policy address is forward-looking, that covers various macro issues. At the same time, we pointed out that the public are keenly awaiting the resumption of normal cross-boundary travel between Hong Kong and the mainland, so that Hong Kong could be integrated into national development. So we want the government to plan for the future and resume cross-boundary travel as soon as possible. That will save our economy. Now, many have said that Hong Kong is at the juncture of change. There is a need for change between the executive and the legislature relationship. The electrical election was held successfully after improving the electoral system. All 90 seats were contested and members were returned after election. That shows that there is broad and balanced representation in the council. This is the Hong Kong style of democracy. We have resumed order in this council for debating issues, and there's some positive interaction between the executive and the legislature, but the new council definitely is not a rubber stamp. There will be heated debates. The public would like the government to improve governance, and the SL government must enhance its governance and remove red tapes. It has to make good all its promises.
On the 12th of January, we had the first meeting of this new term of legislature, and there was also a question time with the CE. The CE, in her opening remarks, mentioned three major areas. First, to establish EXCO-LegCo relations, and to government reorganization, and also development with developing the Northern Metropolis. And she would like to address long-standing issues so that members of the public can feel the effectiveness of the new era with the improved electoral system. The opening remarks of the CE then was an important update of the 2021 policy address. So long as the legislature and executive can cooperate, then I'm sure one country, two systems can sail steadily and far. The Northern Metropolis is a change of mindset. In the past, the colonial government regarded the New Territories as a boundary with the mainland, but now the Northern Metropolis is planned. GBA is pressing ahead at full steam. The development blueprint of the Northern Metropolis can help Hong Kong to make a breakthrough. We can have more land supply and more development in the NT, and people can have homes, and this can help everyone to live happily and have jobs and have economic development. I hope the government can catch up and be decisive in carrying out its plans to map out a new future for Hong Kong. The development blueprint in the 2021 policy address has got the proposed Northern Metropolis, and there are chapters on increasing housing and land supply, and improving the transport structure, etc. I'm sure there will be more and more public works. I hope public works can start as planned so that the sector will have ample jobs. And when I asked an oral question, I said that the administration should do a manpower projection and overall planning for the new infrastructure plan, and it should have plans to address the labor shortage in the construction sector. The SL government should also strengthen Hong Kong's position as a safe city. Safe city would include fight against anti-terrorism, prevention of diseases, infectious disease, water safety, cyber safety, occupational health and safety, etc. Even a few years ago, I was asking the administration to set up an interdepartmental steering committee for a safe city. And with the implementation of NSL, we should have forward-looking strategies to build a safe city, and we should legislate on the relevant aspects. We should enhance the law enforcement agencies' ability to prevent and combat crime, and to promote a culture of safe city, and to enhance our reputation as one in the world. Hong Kong's biggest advantage is one country, two system, and we enjoy proximity in terms of taking part in the overall development of the country. We have got the BRI initiative and also GBA development. We can take part in the dual circulation of the country. The concessionary measures and also the open up measures are already implemented with Hengqian and also Qianhai. Now the total area is now increased by 8-fold to 220 hectares. We can focus on cooperation at areas where Hong Kong has an advantage. Again, it is a boost to cooperation and win-win situation with the mainland, and our INT and testing and certification industries should leverage the strength of Hong Kong to serve the needs of the community. I suggest that the administration should set up a high-level working group to integrate into the overall development of the country, so that we can take part in Belt and Road initiatives and development of GBA. We should further discuss with mainland authorities to simplify the accreditation and also examination or recognition of professional services in the mainland. With these remarks, I support the motion of thanks moved by Ms. Starry LEE. Ms. Carmen Ken. Thank you, Madam Deputy. President Xi has made important instructions on helping Hong Kong to fight the epidemic, and he has care and concern for Hong Kong, and we must work harder in order we can live up to the expectation of presidency, so that we can mobilize all possible resources and do what we can to safeguard the health and lives of Hong Kong people and ensure stability in Hong Kong. As I said, we are now in a war state time, and the commander in such times is most important. The government has decided to set up together to set up tripartite work coordination mechanism with participation from the National Health Commission, the mainland experts and Hong Kong experts. Now, with one country, two systems, we must adopt an all-out approach. And the CSA is responsible for coordinating the 5 task forces. I'd like the CS to elaborate on how he will coordinate these 5 task forces. I suggest we set up a command center to time with the work led by the National Health Commission. Now, LegCo should unite with the community in fighting the epidemic. We should ensure the health of everyone in Hong Kong and ensure stability in society. Yesterday, it was reported that over 12,000 people were preliminary positive and waiting to be admitted. We must demonstrate our commitment in this fight against the epidemic. I've got a few suggestions. Confirmed cases should be properly managed and isolated for treatment. We should ask the mainland authorities to help us to build a makeshift hospital. But that takes time. We should adopt exceptional measures at exceptional times, whether we talk about holiday camps, hotels, public housing estates, then what can be done should be done. If we can identify 5,000 units, that's 5,000 more. So I appeal to everyone in the community, organizations and religious bodies to unite to ride out the storm together, and we should greatly boost our testing capacity. We should be able to identify confirmed cases and transmitters to cut the transmission chains. Universal testing and also compulsory testing on a district basis is a must. Before the arrival of help from the mainland, we must make good use of our healthcare system so that in terms of testing, quarantine, isolation, and treatment, we can do a good job. The number of Omicron cases is growing geometrically. We should add a tracking function to the Leave Home Safe app so that we can achieve early identification, early isolation, and treatment. And I think the current app is lacking. I've already written to the CS4A to tender my proposals. Fourth, I know that people are concerned about possible infections among foreign domestic helpers on holidays. Now, cross-family gatherings of more than two are banned nowadays. But then we have cases where the whole family got infected because of their foreign domestic helpers. So while we respect the rights of FDHs, we should consider extending the scope of CAP 599 to foreign domestic helpers. Now, to ensure social stability, I suggest to the administration that it changes its way of dissemination of information. Relying on 430 PB is no longer enough. There must be a command center from the SL government, not just to announce the number of confirmed cases. Concerns of members should also be addressed. Presidency has made important instructions. The legislature is part of the SAR government, so if there is any specific requests from the SL government, I'm sure all members are willing to comply. With the staunch support of the motherland, I'm sure will prevail over the epidemic ASAP. Mr. Edward Leung, am I coming through? Thank you, Madam Deputy. The fifth wave of the epidemic is raging in Hong Kong, and we now face unprecedented challenges. Whether we talk about frontline healthcare workers or government officials, they're under tremendous pressure. So I'd like to give you a pat on your back, and the central government cares for Hong Kong, and it asks the Hong Kong government to be made responsible in this fight against the epidemic, and all resources that can be mobilized and all resources, all measures that can be taken should be taken to safeguard the health and lives of Hong Kong people to ensure social stability. We understand that the central government has given us unconditional support in this fight, and therefore the government should interface with the mainland to ensure that resources are properly deployed. I believe the confirmed figures are not reflecting the actual situation. People who do their own tests at home are not counted into the statistics, not to mention they're being isolated or treatment. Now, to tackle this problem, I have got 4 suggestions for the government to consider. First, there should be a dedicated staff to hand out test kits to people preliminary positive and tested at home. They should be given priority and treated with priority, because it's hard to tell how many people can make a proper judgment on their own. Second, the Department of Health hotline should be properly manned. People who take the initiative to call the Department of Health should be registered at once, and then they should understand the details of the case, whether it is a serious condition, and whether it is from a high-risk group, to facilitate further follow-up work. Now we have received many requests for assistance. Many waiting to be attended to have got children or elderly persons at home. Some of them have had fever for a few days, but they're not able to contact the Department of Health, so they have no choice but to keep waiting. So we should boost the manpower to answer the hotline for better triaging. Now, hospital beds are bursting to seams. I understand it's not possible to admit all confirmed cases, but with triage, the high-risk patients and those with serious symptoms should be hospitalized at once. And for the less serious cases, although they cannot be admitted to hospital at once, there should be people to follow up on their condition. And when we have sufficient isolation facilities, they should be isolated. I know many people who are under quarantine at home would want to be moved away from their family members. And then we should have more community testing stations. We should have tickets distribution machines, and we should allow people to check online the state of the progress of testing. Now we have more testing stations are set up, but that has not reflected the actual demand for tests. Actually, people who should be tested are not properly tested according to schedule.
Now the Huoyan laboratory is set up with the heightened testing capacity. We should test everyone who is voluntary to get tested, and we should offer multiple repeated testing for neighborhoods are reporting infection to achieve a dynamic zero. We have received a lot of calls for help. They are worried. People are worried about the epidemic, and they are concerned about the vaccine bubble. That's why they want to get vaccinated. Still, a place is hard to get. We have had 2 children who passed away because of the epidemic. It is very worrying for parents. However, despite their scrambling to get their children vaccinated, there is simply no booking place. So I hope the government can set up more vaccination centers and shorten the waiting time, provide more vaccination quota, so people can make vaccination booking online and get a place. Now, in the following, I would like to give my 2 cents about the 6th round of the anti-epidemic fund. I would also like to thank all the frontline staff, including security guards, cleaning workers, as well as the medical staff. With our united efforts, we can surely rise above the situation. Now, the government has rolled out 5 rounds of AEF. In the latest round, the amount and the coverage is more extensive than previous rounds. It shows that the blow dealt by this wave of epidemic is harder than the previous rounds. That's why more support is needed. I thank the administration for accepting suggestions made by the DAB, including my request to provide frontline cleaning workers and security officers with additional subsidies. It is a recognition for the work. It also reflects their longer working hours and the huge pressure they are facing under the epidemic. The subsidy is not does not directly reflect their sacrifices. However, I think this is a good way to show our appreciation, and also for frontline cleaning workers and security guards of private housing estates, which were not covered by previous rounds. They are covered in this round, and we are happy that the government has accepted our suggestion. Despite the wider coverage, it still doesn't cover UGC funded tertiary education institutions, NGOs, and raising course staff, and so on. The burden that they have is the same, but they are left out. We understand that the situation is very complicated. That's why it is inevitable that someone is left out. It is our role as Legislative Council members to fill the gap and remind the government who has been left out. And about the temporary unemployment relief fund, that is something that the DAP has been calling for. In the past, the government has been rejecting this idea. They said it is infeasible. Now the government is breaking out of from the mindset and is implementing this measure. This is applaudable. It has received support from across the political spectrum. The $10,000 may not be a huge help. Still, it is a positive thing, and we welcome the government's show of compassion. It really throws a lifeline to people. So it is very important to disperse the fund promptly. Now the government said the fund would be dispersed in March or April. I think the government should compress the timetable to offer help more promptly. In the Finance Committee's meeting, I thank the administration for giving me the reply that the government would do it as soon as possible, and not a day later. I appreciate the reply. Now, sometimes the measures are too slow to help. Still, I have heard a lot of good things from the public in relation to the Secretary's reply. So I hope the government can offer prompt, swift help to people unemployed. The pandemic situation has been over our head for a long time. We have come to the sixth round of AEF. No system is perfect, so it is the important thing is we have to plug the gap. Finally, I thank the government for leading us to do what's said in the theme today, that is emerging from the epidemic. Thank you. I shall submit. Professor Nelson Lam. Thank you, Madam Deputy. Today, President Xi Jinping has offered the latest direction concerning Hong Kong situation. He is highly concerned about our situation, and he offers heartfelt regards and concerns for our situation. I truly thank the country for its care for Hong Kong. Now, recently, members have been putting forward urgent questions to discuss the matter. We share the same goal, that is to make Hong Kong's anti-epidemic work more down-to-earth and more adequate and efficient. Now, this is the top priority right now. Madam Deputy, I would like to thank the frontline medical staff. We are recording record high cases every day. According to the news, we are going to have 4,200 new cases today. There is a serious shortage of frontline medical staff. Still, the medical staff are remaining steadfast. Some even got infected. Yesterday, the number of medical officers that are infected reached 100. It is worrying, and it threatens the stability of our healthcare system. On behalf of Hong Kong people, I would like to thank every medical officer in Hong Kong. I hope all healthcare workers who were infected would recover soon and join the fight again. Now, it is very touching that we see people's compassion during the fight. People are showing the Lion Rock's spirit. volunteer groups, community organizations, townsmanship organization, and people from different political parties are offering help in terms of money or other kinds of help to alleviate the situation. So like Presidency has said, we should mobilize all available resources and take all necessary measures to fight the epidemic. The government can take initiative to mobilize forces from the community, including civil service force or even those civil servants working at home, community organizations, and other volunteers. With the government steering, they can join the fight at the front line or offer other kinds of help. Now we are seeing exponential increase in number of cases. According to the University of Hong Kong, by the end of March, we will have 28,000 new patients every day. Before we see this tsunami figure, I think we have to adjust our mindset and maintain the resolution. We have to perform community-wide testing. Now we have the Stay Home Safe program. Confirmed patients are staying at home. Homes are very small in Hong Kong, and inevitably family members will get infected. During the stay at home, we have patients living with 3 or 4 family members together, and the number is bound to rise. We see families with infected members facing a shortage of daily supplies. Even if everyone is exercising self-discipline and stay at home, they may still get infected. And then when they are infected, they don't get the help they deserve. It is very heart-wrenching. One of the reasons why this wave is so bad is that Omicron strains patients do not have symptoms. So we really have to put the close contacts and household members into quarantine to achieve a dynamic zero. Now the government is offering antigen rapid test kits to people, but the accuracy is lower. People who have to work may deliberately conceal their positive results. According to the mainland's experience, launching universal testing is the most effective way to cut the transmission chain. I urge the governments to call for help from the central governments to engage in universal community testing in Hong Kong so that virus will not enter the community. I understand that the Huoyan laboratory at Ma On Shan was commissioned yesterday. Still, it only helps to speed up the testing results by 1 day. Even if we ramp up the testing capacity to 300 or 500,000 per day, it will not help much. The point is we have to ask for help from the central government. With the help from the 2 Huoyan laboratories, we still don't have enough test helpers. The government should request infection control experts from the mainland to guide our efforts, including increasing testing capacity, increasing vaccination rate of elderly people and the children. They are the most vulnerable groups. We have to protect them. We cannot lose any one of them. Besides central government support, the government should also enhance its own work and fill all the gaps. For example, ensuring the supply of anti-epidemic supplies, enhancing publicity, identifying sites like vacant schools, religious premises, and so on, and implement real name registration for Leave Home Safe and combine the app with Octopus cards and so on, so as to enhance the tracing method, and invoke the emergency law if necessary, emergency regulation if necessary, to mandate foreign domestic helpers to stay home. Now, there are some 50,000 long-term visitors in Hong Kong. They stay in Hong Kong on a regular basis, including those staying in Hong Kong with a visitor's visa. They may incur a huge sum of medical expenses. The government should consider aligning the standard for medical expenses between these groups and Hong Kong citizens. Now, the government should ask for help from the central government and identify the lackings in its efforts and take extraordinary measures to swiftly achieve the goals of protecting the life and health of Hong Kong people, as well as maintaining stability of Hong Kong society. I believe that if we are united, we can surely emerge from the epidemic. So let's work together and stay healthy together. I so submit.
Mr. Holden Chow. Thank you, Madam Deputy. President Xi Jinping made some important instructions that the SL government should spare no effort in fighting the epidemic. Now, our confidence is much boosted with this news because with the support of the central authorities, we have the confidence to prevail over this epidemic. I would like to express my gratitude to the frontline healthcare staff for working so hard for such a prolonged period in this tough battle. But I'm sure if we are united, then we will be able to triumph over the epidemic. Here, I would like to make a number of suggestions so that the government could do an even better job in fighting the epidemic. Firstly, isolation facilities. Many confirmed cases are waiting at home for isolation. What the government is doing is to use all possible venues, such as holiday camps, hotels, exhibition venues, and so on. Now, I believe there's a need to build a makeshift hospital too, with the support of the central authorities. With these hospitals, then we will be able to group serious cases and mild cases, and then there could be instantaneous isolation because that's the most pressing issue. Secondly, with vaccination arrangement, young children and elderly should be the priority in administering of vaccines. I understand the government has already put in place various support measures to boost its vaccination rate. Now, we see many parents are saying that, say for instance, in Tu Mun District, they would like more vaccination centers for children to get vaccinated. We also suggest that the Education Bureau arrange outreach teams so schools could ask children to come back on a particular day for vaccination, because that's the best and easiest way to give vaccination to children in one go. I understand the Education Bureau is working in that direction. The next step is about asking schools to cooperate in this exercise. For kindergartens, I see that starting from yesterday, children at the age of 3 could also be vaccinated. I asked the Education Bureau and the Department of Health to make arrangements and do the same. That is, ask students to go back to kindergartens on a particular day for vaccination by outreach teams. This will be the quickest way to make sure children are vaccinated. Because when children have to go to community vaccination centers, they have to queue up as well. Now, there is such a strong demand, and there's a need to administer vaccines to young children, so I hope the government will work in this direction. Thirdly, there are already there's already Chinese proprietary medicine approved by the government on the mainland to help infected patients. Now, there are many infected patients waiting to be sent to isolation facilities. Perhaps the SAR government could procure the Chinese proprietary medicine and give it to the public. That is this one particular brand name Lianhua medication that's approved by the mainland. So perhaps the government could approve the use of this medication so that it could be distributed to infected persons while they're waiting for isolation. So this might help them to ease their symptoms. Now, I know that if the government will give help, and then we could have experts coming to help with testing for over 1 million people every day, then we could deal with the current situation of a long wait for vaccination, especially for those who need to be tested compulsorily. I think if with experts coming to help us, we surely can address this issue. So these are my suggestions. I hope the government will consider them. Now, in particular, I would like to thank frontline healthcare staff. I understand Professor Sophia Chen has been working very hard in the past periods, and this is not an easy task. I want to encourage her to keep up her good work. And then together, we could prevail over the epidemic. So I speak. Ms. Doreen Kwong. Madam Deputy, first, I would like to express my heartfelt gratitude to the nation for giving us emergency support and supplies that will certainly help us in our fight against the epidemic, and it helps to also give confidence to the people of Hong Kong. I hope the SL government will consider all the resources we have and examine what we have, and also examine our measures so that we could put the epidemic under control soon. I would also like to take this opportunity to thank all the healthcare workers and all frontline workers for their hard work in the past 2 years. Chinese funded organizations and many other bodies have been organizing volunteer teams to help out everybody. So now, I'd like to share with you an observation. In the past 2 years, where with every wave of epidemic, the government would host press briefings every day to give out information on such information. I think we don't just look at the quantity but also the quality. Now, the government only provides total case numbers, but perhaps if the government could provide more data, then there's no need to hold daily press briefings. The government could also give analysis for different districts and for different age groups, so it could then respond in a timely manner and come up with various measures. Now, the government could also receive useful information with such analysis. There is no need for people to be spreading words via on the phone, and that causes unnecessary concern. Now, the government could provide a daily update and analysis of data. For example, the number of new confirmed cases and suspected cases, the number of patients hospitalized, and also the number of people receiving vaccines and the versus hospitalizations. We know about the effectiveness of those who've received vaccines who need to be hospitalized. And then we also need figures on those in ICUs, serious condition, and so on. We also need data on recovered cases and death cases. The government could update the figures every day. We don't just need the cumulative figures, because we want to be able to learn about the latest trend. For example, some governments, like those in Singapore and New Zealand, they provide a website to update information every day. They also give analysis every day. They group cases by age, district, and so on. And then they also give 24 hours update of sources of infection and so on. Now, with the fight of epidemic, we it is important that we have scientific data, and we don't just want to look at figures. We want to see what's behind the figures. That is, there is need for precise analysis. Now, if we have an effective anti-epidemic system, we want that, and want the cooperation of the public, we need to have precise and timely data analysis. Now, of course, we cannot avoid infection, but then we could avoid a possible risks or a negative impact. Now, the fifth wave has really dealt a severe blow to businesses, in particular SMEs. I hope the government will listen to the views of the public and learn about their problems. We need to use strong and targeted measures to address the pressing concerns of the public. Thank you. Mr. Jeffrey Lam. Thank you, Madam Deputy. Now, Hong Kong has been fighting this epidemic for over 2 years. We are now seeing the most severe wave of outbreak. Now, we're talking about the safety of the public and the livelihood of the public, and they are all under threat. Now, I would like to thank President Xi Jinping for making important direct instructions during this critical time and supporting our fight against the epidemic. The central authorities will give us support in terms of manpower and resources, but then Hong Kong people must also make an effort. The government departments and all sectors and community must all work together to prevail over the epidemic. Now, the central authorities have always been supporting Hong Kong's target of dynamic zero infection. Our strategy is clear. That is, we won't go for the living with COVID strategy. But then what is the problem here is that we're not able to follow fully all the measures adopted on the mainland. In terms of preventing import cases and local infection, there are indeed loopholes. We're not able to preempt situation. Very often we would only respond to situation, and we wouldn't be able to foretell any problems. Of course, now there's been much improvement. Now, the fifth wave hit us all at a sudden, but because we've done a good job in but because we've not done enough to prevent import cases, that's why the Omicron variant strain has entered our community. And then we see there are satisfactory arrangements with community testing. People, in particular elderly, have to wait a long time to get tested in a code, to get tested. And then now the government has responded to public views, and they have set up community care queues and also ticket dispensers. At the same time, we should take advantage of the testing capacity of the mainland so that we could boost our own testing capacity to 1 million tests per day. Now, I would like to thank all those fighting the epidemic, in particular the health frontline workers. With this outbreak, of course, that's brought our attention to our testing capacity and also the healthcare system's capacity. Now, we're going to see a record high of confirmed cases today. Many also expressed concern about home isolation. The safe home there is this scheme, home isolation scheme. I know many sectors support that. I know many quarantine hotels have been turned into isolation facilities. Perhaps we could do better on two fronts. One, if, say, someone tested positive, the government should go one step further in sending out SMS messages. That is, they tell people when they will be contacted by government staff, because people would be at loss after receiving notice of a positive test. They don't know what to do. So I think it's important that you tell them when they will be contacted. Second point, with the safe home scheme, people have that is with home isolation, people have to wear electronic wristband, and then there should be more stringent measures. Family members living in the same household should not be allowed to leave the units. But of course, then there's the question of providing them with meals and daily necessities. The government should come up with a new mindset. The government needs to think out of the box to solve the problems. I'm sure the business sector will be prepared to help here. And then in terms of dissemination and information, the government needs to make improvement too. I see that the Director of Information Services post has been vacant for some time. There's someone acting in the post, and it is not really desirable as we try to fight this epidemic. For example, at 3:30 p.m. on the 8th of February, the Chief Executive announced a series of stringent anti-epidemic measures. But the details of the measures are only released in a press release after midnight. So in the process, there's been much misunderstanding. People became anxious, and people were worried when they might have to scan the leave home safe before they could enter a shopping mall. So there was much confusion with the information spreading around. The government, I thank the police for making a clarification in a timely manner. So I think the government has to move swiftly. When there's any new measure, there should be, questions, frequently asked questions, so people know about the information. And of course, I have to be fair too. The government has made much improvement in disseminating information.
One example is rumors about lockdown. First, Mr. Johnny, CS4A, said categorically there will be no lockdown in Hong Kong. And yesterday, the CE confirmed that this is of most importance to Hong Kong's status as a world financial center. There can be no room for ambiguity. Now, with the state of the epidemic, all sectors have been hard hit, and SMEs are at the forefront. So we welcome the administration to launch various measures to continue to support our community so that we can rebound. I suggest that the government launch and enhance the ESS to provide wage subsidy for sectors hard hit by the epidemic, and the government should accept BPA's suggestion that $10,000 worth of consumption voucher should be given to celebrate the anniversary of the handover, and there should also be extension of the 100% loan guarantee scheme, and so that the community can be given the help they need most. And the administration should consider how the community as a whole can create wealth together. I think this is a problem for all of us. Early resumption of normal cross-boundary travel is not just a wish, common wish of a people. It's also a way for us to revive the economy. Madam Deputy, I also hope that the administration can set up a GBA corridor for mutual recognition of the Yuegang Code and also the Hong Kong Health Code, so that business travelers can travel to and from the mainland quarantine free, and we hope that there can be more cross-boundary crossing points and also operating around the clock. In particular, the administration has proposed that the Northern Metropolis and the Santian Technoport be developed. If we can have sufficient manpower and supporting conditions, then we can help Hong Kong to revive after the epidemic and integrate into the country's overall development. To fight this epidemic, the government should listen to the suggestions from the community and from the legislators and different sectors of the community so that you can really address the greatest concerns of the people, and then you can really establish good ties with the between the executive and the legislature. The title of the policy address is building a bright future together. We are at a very important point of the fight against the epidemic. Complaints are not going to help. I hope we can all unite and adopt dynamic zero infection as our policy and boost our vaccination rate as much as possible. Thank you. Mr. Chen Kim-po.
陳健波議員。係得啦嚇。
Mr. Chen Kim-po, am I coming through? Yes. Thank you, Madam Deputy. The fifth wave of the outbreak is very serious, and people are panicking. According to Hong Kong News projection, the peak will only be reached in March. By then, daily number of confirmed cases will reach 10,000. This is scary. However, we don't have to worry too much because the central government has promised to help Hong Kong, and the government has also set up 5 task forces. What we need most now is testing and treatment facilities, and also logistics arrangement in fresh supplies to Hong Kong. With the help of the central authorities, I'm sure we can stay focused to fight the epidemic. Now, this virus is very cunning. It keeps mutating, and we are most grateful to the healthcare workers, the frontline disciplined officers for serving the public in great dedication in spite of the risks they face. However, the number of confirmed cases rose sharply, and inevitably there are grievances in the community. For instance, some young patients could not be admitted soon enough, and there is also chaos in dissemination of information leading to complaints from the community. This reflects a lack of coordination on the part of the administration. And of course, the frontline workers have been working very hard, but they are nearly exhausted. Frontline work involves the Department of Health, the Home Affairs Department, the police, the FEHD, as well as outsourced contractors. Who is the commander, or are they doing it on their own? It's okay for individual departments to carry out their own duties, but when it comes to coordination, that is the sticky point. Given that we are at exceptional times, we should have exceptional measures. We should set up a command center so that officers with the executive caliber should be there to command the front line. I think this is most important. The government should set up more Huayan laboratory and build makeshift hospitals. The Huayan laboratory has now resumed operation, and the central authorities will send manpower to help us. So this is not a problem. But for operating a makeshift hospital, we need a large amount of healthcare workers. There are suggestions that we should have mainland healthcare workers to help us, but then the two systems are different, and there may be hiccups. I'm of the view that the mainland healthcare system is in no way inferior to ours. This can be shown in their achievement in fighting the epidemic in the mainland. To have sufficient manpower, we must allow mainland healthcare workers to help. And there is a suggestion that we should have a lockdown in Hong Kong. While we cannot rule out that possibility, right now we should keep up with our good work, because a lockdown inevitably will affect our economy and undermine our position as a world financial center, and hence the livelihood of our people. When there is an outbreak, I think we can have district-based lockdown, and that can facilitate support workers as well. Everyone should do his part. We should ask ourselves what we can do. At the very least, we should be vaccinated. We should be tested. We should support the government work, and we should be understanding to the plight of our healthcare workers. When we stand united, I'm sure we can prevail over the disease. Thank you. Mr. Ronik Chen. Thank you, Madam Deputy. Well, the global epidemic has been raging for more than 2 years, and Delta and Omicron are two variants very active in the U.S. and Western countries, and Hong Kong is no exception. In fact, prior to the fifth outbreak, we were in a rather stable condition. We thought that we could resume normal cross-boundary traffic. But then Delta and Omicron outbreaks have dashed our hopes. However, so long as we follow the instruction of President Xi, and if we mobilize all resources and take all available measures, then I'm sure with the commitment and the determination, we can help the whole community out of the plight. And in fact, members have been very cooperative in wearing face masks. I hope we can expedite the vaccination of elders and children. Schools and RCHs must help. Elderly persons are not too willing to take vaccination, while hospitals have made special arrangements, but it hinges upon the advice of doctors. If doctors are willing to advise, then I think it will have an impact on elders' wish to be vaccinated. Schools have a major influence on children. If they are supportive enough, I think children will be more willing to receive the jab. And then we should continue to improve our testing, vaccination, and treatment facilities. I went to Shenzhen to meet with Mr. Ha Baolong. When I came back, I had to take 6 tests, 2 in community testing centers, 4 in community mobile stations. Now, most community testing centers are in places like sports center, but then these places are usually rather crowded. So 1 or 2 people cough there, then it's awkward. We have football pitches. I think they can be used for vaccination centers, and we can also use them for proper social distancing. And we don't have any tracking function in the Reform Safe. For instance, if people use a SIM card with no registration, or use another person's vaccination record, that would circumvent the government's tracking efforts. And most of the hospitals and isolation facilities are saturated. While the government has just announced that thousands of rooms will be available from hotels, public housing estates, and even university student hostels. But I think we can look out for suitable facilities in each district, such as vacant school premises, so that members of the public do not have to travel to another district, that they can just be isolated near their homes. And I think Mr. Holden Chow has mentioned the use of Chinese medicine for treating COVID-19, and I have friends who use Chinese medicine to deal with their illness as well. I suggest that Chinese medicine be called in to help to shorten the stay in hospital, to lessen the burden on our hospitals. I'm most grateful to our healthcare workers. They are fighting day in, day out, and the central authorities have been very forthcoming in addressing our requests. However, the government should deploy civil servants to serve as volunteers to fight the epidemic. The 5th outbreak is a test to our capability. But then compared to Wuhan 2 years ago, which had little knowledge of the disease, we have got experience and knowledge. Wuhan was able to resume normal life within 72 days. I think we should be more confident in winning this war. There is no shortcut. The government has set up 5 task forces with mainland experts. I hope that we can very effectively and swiftly cut the transmission chains in Hong Kong so that we can kick the disease out of Hong Kong. I will speak in other sessions on other areas of the PA. Thank you. Dr. Johnny Ng. Thank you, Madam Deputy. The 5th wave of outbreak is